Hi guys, how are you doing? I hope you are doing well and welcome. Thank you so much for tuning in. And also guys, do not forget to subscribe, do not forget to share, do not forget to like, and also do not forget to comment down below in the comment section if you have any questions in the previous topics that we have discussed. Just if you have any question, go down there in the comment section, ask all those questions that you have. I will try in my level best to answer your questions. So welcome. Today I want us to learn a very sensitive topic. If you remember in our previous topic, we learned about the danger signs in pregnancy, and one of the danger signs in pregnancy, we talked about having severe headaches, and also we talked about if you have blurry vision, if you start developing having blurry vision or severe headaches during pregnancy, it is those are among the danger signs in pregnancy, but because they are signs of high blood pressure during pregnancy, which is life-threatening both to the mother and to the unborn baby. So today in this topic, I want us to learn about high blood pressure in pregnancy. Okay, I want us to learn what are the complications of having high blood pressures during pregnancy. So today our topic is preeclampsia. That is a medical term that means having high blood pressures during pregnancy. Okay, so what is preeclampsia? Preeclampsia is a new onset of high blood pressures during pregnancy. Onset of high blood pressures during pregnancy. For the doctor to diagnose of preeclampsia, he must take 2 readings of blood pressure at 2 separate times. Okay, if you have 2 readings of high blood pressure at 2 separate times, that means you have preeclampsia or your blood pressures are high. Okay, so this preeclampsia occurs when your baby is 20 weeks and above. That is when it occurs, and it is life-threatening if not treated. Okay, that is why you are advised to check your blood pressures throughout your pregnancy to ensure that they are within the normal limits or the normal ranges, because if they are high, then your life is at risk, and also the baby that you are carrying is at risk. Okay, so I want us to learn the clinical features of preeclampsia. Number 1, we have high blood pressure. 2 separate times your blood pressure is high, then that means you have preeclampsia. We have swelling on your face and hands. If you notice that you start having a puffy face, swollen hands, and also swelling on your lower limbs, check your blood pressure to ensure that it is okay. If it's high, then you have preeclampsia. We have intense headaches. We have blurry vision, vision problems, start having blurry vision. We have nausea and vomiting. We have difficulty urinating, and we also have abdominal pain on your right side, right below your ribs. Okay, if you experience that pain, then you might be having preeclampsia. You need to go to the hospital for a checkup. Okay, those are the symptoms of preeclampsia. So what are the risks? Who is at risk of getting this preeclampsia? Number 1, we have people gestational the hypertension or chronic hypertension. If you have been having high blood pressure even before conceiving, then during pregnancy you will have preeclampsia. We have people who are older than 35 years. If you conceive when you are past 35 years, you are at a risk of getting preeclampsia. Also, if you conceive below 20 years, you might develop preeclampsia. So you need to plan yourself so that you do not conceive when you are below 20 years, and also when you are above 35 years. Okay. We have people with twin pregnancy tend to have high blood pressure during pregnancy. People with kidney disease, people with diabetes, people who are obese, if you had preeclampsia in your previous pregnancy, then in your subsequent pregnancies you might also develop preeclampsia. If you are in this group of people that I have mentioned here, let me say you are a high risk mom during pregnancy, so you need a special kind of care to control your pressure during pregnancy. Okay, so what are the complications of high blood pressure during pregnancy? Number one, this means your placenta will not receive oxygen as required, and also nutrients to the baby, and that will result in slow growth. Okay, you might end up getting a baby who has a low birth weight. Okay, you might have a preterm baby, or you might end up getting a stillbirth, giving birth to a baby who is dead. Okay, you see, this means high blood pressure is dangerous. Okay, just imagine high blood pressure leading to you getting a baby who has a low weight for the gestation. Okay, you will have a baby who is term, but the kgs are low. We also have giving birth to a dead baby. We have placenta abruption. This means your placenta can detach from the uterus, and this can lead to bleeding, severe bleeding, and the mother might die, and also the baby. Okay, we have eclampsia. So if high blood pressures during pregnancy are not well controlled, okay, they will progress to complicate now to a condition called eclampsia. High blood pressures during pregnancy is called preeclampsia. If preeclampsia is not well managed, it will progress to eclampsia. Okay, now these are dangerously high blood pressures during pregnancy, and this eclampsia can lead to a stroke. Okay, a stroke is a permanent brain damage. Okay, permanent brain damage, and this can lead to death of the mother and also the baby. Okay, so if preeclampsia is not well managed, if you have high blood pressures during pregnancy and like you don't go on checkup so that your doctor can manage your blood pressure, it will progress to forming eclampsia. Eclampsia is a severe complication of preeclampsia. Okay, This is a serious condition where high blood pressures results to seizures, okay, during pregnancy, or convulsions. This is a period of disturbed brain activity that results in staring, decreased alertness, and violent shaking, also called convulsions. Okay, imagine if your blood pressures are high, they are not well managed, then you will progress to a condition called eclampsia. Now this is when you start having convulsions, you have agitation, loss of consciousness, seizures. Okay, and this now is serious. Okay, because this deprives your baby of getting oxygen, and the baby might end up dying in your womb, and also the mother can die. Okay, yes. So how is preeclampsia managed? High blood pressures in pregnancy, you are given antihypertensives to lower your high blood pressure. You will be given magnesium sulfate to prevent the mother from going into seizures, and also they will be given corticosteroids, okay, to help mature the lungs of the baby, because if now the doctors try to control your pressure, but it's uncontrollable, before you go into eclampsia, which is life-threatening, which can lead to death of the baby and the mother, your doctor might decide to induce labor, okay, depending on the gestation of the baby, depending on the maturity of the baby. They can induce labor, or the mother can go into an emergency CS to save the baby and also the mother, because high blood pressure leads to death of both the baby and also the mother. Okay, yes. So in my next topic, I want to teach you about eclampsia and your baby. Okay, what happens when you go into convulsions? So eclampsia and your baby, dangerously high blood pressures and your baby. Okay, so thank you so much for tuning in. As you can see, high blood pressure during pregnancy, life-threatening. So all moms should be alert. Once you start having a severe headache and also blurry vision, rush to the hospital, and also start your antenatal clinics early, and also make sure you follow your doctor's instructions. Go for all antenatal visits during pregnancy. Okay, make sure you go for 4 complete visits, or depending on your pregnancy, your doctor will tell you if you need more than 4 visits or 4 visits. So but ensure you visit the hospital, your blood pressure is okay throughout your pregnancy. If not so, make sure you are started on blood pressure medications, so that you and your baby are both okay. Okay, thank you so much for watching. Remember to subscribe. Let's grow this channel. I can see we are growing. Please share this information. Feel free to share. Also feel free to ask any questions about high blood pressure during pregnancy. I will try in my level best to answer you. Thank you.